Hello, my name is Marisol and today we are going to be teaching NVQ level 4 in laser hair removal and IPL. So today we're going to be understanding the skin and the hair type for each of one of our clients. So with the Fitzpatricks we are going to be doing from phototype 1 to your phototype 6. So these are your Fitzpatricks of each of one of our clients. So for example, as we can see here, this is your type 1. So this is going to be your light, pale and white skin. These people, you have to ask if how they tan in the sun. This means they always burn, never tan. So this is going to be your phototype 1, which is very pale skin. Secondly, now is going to be your type 2. So this is your white and fair skin. So usually when they have their sun, these people do usually burn, tan with difficulty. So they do have a hint of tan, but they burn before they go a little bit more reddish. So these are going to be your type 2 type of clients.
Okay.
So now we're going to be talking about the Fitzpatricks of different types of skin types. Okay, so now we're going to look at type 1. So these are going to be your light and pale white skin. Okay, now we need to ask some very important question here of how the clients do tan when they go in the sun. So you're typically type 1, they always burn, never tan. So this is very pale skin. This could be people from like Norway, very pale, where they don't really see the sun much as well. Then you have your Fitzpatrick type 2, which is your white and fair skin. They usually burn and tan with difficulties. So these are going to be a little bit more tanner, but again, you're still your different types of Fitzpatrick, which is more lighter skin types. Then you have your type 3. So these are going to be your medium white to olive skin. So sometimes mild burn and then gather tan to olive as well. So these are the people who tan quite well and they can actually not burn so much as well. They do burn but not as bad as your type 2. Then you have your darker type of tones now. These are your olives tan. So these are going to be your phototype 4. So they rarely burn and then tan with ease and moisturous brown. So these are going to be your in-between clients of your lighter skin types to your darkest. So they're right in the middle as well. So we do have to kind of consider our skin types very well. Once we talk about the hairs, then we have to talk mainly about the skin types. Now you have your type 5. So these are your light brown. So they rarely burn and tan very easy. Okay, so these we can work with lots of types of lasers outside in the industry. And then you have your type 6. So these are your dark brown to black type of skin types as well. So they never burn and tan very easily depending on pigment. So by understanding your Fitzpatricks in your scales, then you can decide on what laser and what nanometers you need to use for the skin that they are. But of course now we have to talk about hair types, because laser doesn't work for all of the colour of the hair. So as we're looking at different types of colour of the skin, but now we need to look at the colour of the hair to see if it's going to be suitable to do laser hair removal. Okay. So in the before we was talking about your Fitzpatricks of different type of skin tones. We do need to talk about the hair colour to know if the laser will be suitable for each individual. So here we're going to have a look at different types of hair colour now. And then after, we're going to ask you guys to see what type of Fitzpatrick and hair type. And again, we need to know about the fineness and thickness of the laser to make sure if this will be a correct treatment for you. And this is what we will discuss once we do consultation as well. So here we have, of course, different types of hair types. So we have our red hair, we have our blonde hair, light blonde hair, white grey, dark, light brown, and then dark blonde. So different types of hair unfortunately does not work for laser hair removal. So we have redheads. Redheads have less pigment in the cortisol of the skin of the hair type, which we will go into the anatomy and physiology of the hair. So it doesn't have a lot of pigment, as fortunately the laser will not attract to those type of hair. Same as your light blonde hair, lack of pigment again. We are working with melanin, which we will explain in a few moments. Then you have your white and grey hair, which it does not work. Then you have your dark, which is your black and your really dark brown type of hair, which will, as it has more melanin into this area. Then you have your light brown again, it will be working very good. Now with your dark blonde, this is a little bit of a grey area. Sometimes it might work, sometimes no. But however, we can do patch tests beforehand as well, okay? So we'll have to just decide in what type of our skin types and our hair colours to make sure if the laser will work. Also, we need to look at the hair thickness. So, for example, our underarm and bikini hairs, they are much more stronger, coarser hair. Sometimes we are born with vellus hair, which is very baby fine hair that usually are found on the face, maybe even on our hands, sometimes even on our backs. But these hairs, you can't see them unless you're maybe in the sun. They look a little bit more blonde. Then you have your darker, little bit more long hairs that usually occurs more on the arms or legs area, especially the lower legs. Upper legs might be a bit more finer. So our job is have to identify if the skin type, which is your Fitzpatrick, and your hair color and thickness, to see what type of laser and if it will work. So as already I introduced myself in what course we're going to be doing, first of all we need to understand each and every topics that we'll be doing in this class. So we're going to do induction, which is welcoming myself, and after we have to do skin types, hair color. We are going to look at the characteristics of the hairs, the safety of laser hair removal, and of course PPE that we need to cover, which is very important. And especially once we go into the laser room, we need to make sure all the PPE and the correct equipment are safely installed, which will be done in clinic as well. Then we need to do a recap and then question of answers. So anything that you don't understand or anything you want me to kind of explain again, we'll have to do that. And of course, we're going to just to do more practicals in the clinics as well. Okay? Yeah. So once we understand the Fitzpatrick's and the hair color and the quantity, the hair character, this needs to be done when we do patch tests. So patch test is included in our consultation with our clients. We need to make sure medical history, any medication the client's taking, to make sure that we can play these laser hair removal nice and safeties for our client. So it's very, very important to do the patch test / consultation. And then this time you will have a look at your skin types, your hair color, and the quantity of your hair characteristic. So first of all, we'll start with yourself, Monse. So as you saw already the Fitzpatrick, what would you say you are? So if we go back to our Fitzpatricks here, so as we would already discuss of how we do each and one of our sort of burn-in, so this is when we have the sun. So would you consider yourself as a type 1, which is always burn, never tan, which is your Fitzpatrick's 2, which is you usually burn, tan with difficulty?
No.
Your Fitzpatrick 3, which is going to be sometimes mild, burn gently, tan to olive.
Yeah.
You can be even your Fitzpatrick 5, which is your olive tone, which is rarely burn, tan with easy and moisturous brown.
No, I think it's more type
3.
Yeah.
Yes. May I know what your background is? So as we discussed about your Fitzpatricks, Monse, where are you from originally?
I'm from South America, from Chile.
Okay, so we have diagnosed that you'll be your Fitzpatrick type 3. So you sometimes mild burn and then gently tan to olives. And then Caroline, of course we have Caroline with us today, and you can see she is our Fitzpatrick's. I would say, which one would you think you would be?
Type 2.
Type 2. So you usually burn, tan with difficulty. Yeah.
Yes.
And what is your background?
I'm from South America, Chile as well.
Okay, so as we can diagnose that our Fitzpatrick is very, depends on where we are from the world. As you are both from Chile, as you can see, Monse has a really dark complex of her skin tone, plus she's got dark hair. You are more fairer and you have red hair. So this is what we need to discuss in a patch test and our consultation to check what type of lasers and if we can do laser in different types of hairs. Okay?
Okay.
So as we have identified now about our Fitzpatrick's and our hair colour, we need to understand as well the characteristics of the hairs. So here we have a diagram of our skin types. So skin type and your hair shaft. So this is going to be the hair follicle, and just understand the structure of the function. So here we have our skin, which you can see on our surface, and then here you have the hair. So here the first thing we need to do is look at your skin and your hair. So if we can just show our arms for now. Thank you. So first of all, we're going to start with Monse. So Monse, we have more your type 3. We can see, of course, you are 3 and the hair type. So you can see you have different types of hair on your upper arms. Upper arms is different to your lower arms and to your hands. So here we need to identify if the laser will be suitable for yourself. So as you already know about the Fitzpatrick, we said she's a type 3. And the quantity of the hair, there is a lot, and there is a lot more melanin in the area. So laser we will be able to do on Monse upper arm. Now if we have a look at the hands, these hairs now are going to be your vellus type of hair, which is your kind of babyish hair, which you can't see maybe in the sun. When you shine a light, you could probably see them. We have a lot more coarser hairs on our underarms, our pubic type of area as well, and our lower legs. Upper legs, maybe our body, so maybe our tummy line, we might have a little bit more thicker hair. Back, sometimes it depends, we might have a bit thicker hair, but it depends of course on lots of types of background on those cases as well. So by laser hair removal, now we need to find out with the type, the length of the hair and the quantity of the hair. So we need to see how thick and fine they are. So by looking at Monse's hand, these were going to be more difficult for Monse to see results as well. Okay, so this is what we will explain when we do our consultation / patch test to see which we can do as well. So here we have now the hair follicle. So lasers, as it works by your color of the hair, so we need to identify now the hair shaft, which is on the top bit of the surface of your hair. So let's just say these are going to be now your black hair. So laser attracts by melanin. So we apply the laser on top of this area and it shoots all the way down. So we go through a lots of types of our layers of our skin and then go into the hair papilla of the area. So this gently dies, which is your hair bowl. So by killing the hair bowl and the papilla, which is and the cortex, which is going to be your melanin, this is how hair eventually does die down. So it's very important when we do a consultation / patch test as well to make sure every expectation is going to be 100% correct for your clients as well. So as now we have a diagnosis and the hair characteristics and the Fitzpatrick and the hair colour of Monse, now we go on to you, Caroline. So as we already diagnosed, you are going to be your Fitzpatrick's 2 as well. So if you put your arms out, okay, so we can see here that we have freckles and the hairs are very vellus and you can't even see. So they are going to be more your lighter, blondish, reddish type of hair, which in this case, unfortunately, the laser won't work. Okay, maybe we can have a look at areas of the underarms or maybe the bikini area, your pubic area, but this will be done by the time that we do your patch test and consultation to see is all is fine to do the laser hair removal as well. Okay. So now with that, we've discussed about your Fitzpatrick's, the hair color and the hair characteristic. We do need to talk about there's different types of laser and impulse light in different types of clinics. Okay, so in our clinic we do work with a diode technology. So here we have to explain of the lasers types. So the main types of laser hair removal machines are Alexandra, you've got your NDY YAG laser, and you have a diode laser. So these are typical going to be different types of your nanometers. So we have Alexandra, which is your 755. Nanometers means of how kind of deep the laser goes. So if you have your hair shaft, as we already discussed, so it depends on how far the laser light goes in, and it needs to penetrate into your skin color. So we need to make sure we're all careful with different types of lasers, and this is very important when we do our consultation patch test to make sure we are doing it in a safe manner. We will look into your contraindication and as well skin burns, unfortunately, but this will be a topic later on. So this is why it's very important to know about your Fitzpatrick's, your hair color and the hair characteristics of the area. So as we can have a look here, we have Alexandra. So this is going to be your 755 nanometers. This is best for lighter skin type tones, which is going to be your fit patches between 1 and 3. So 1, 2 and 3, which is for dark hairs, and this type of lasers you do see very fast the type of results. So the fairer you are, but the darker the skin color and the skin hair is much better. Okay, so this will absorb the melanin even quicker with this type of laser. And then we have your ND YAG. So ND YAG has a 1064 nanometers. This is safer choice for your darker skin types, which is going to be your Fitzpatrick's 4, 5 and 6. So remember your Fitzpatrick's, which is going to be your darker skin types. So it could be even your very dark Indians or your black skin as well. So this is going to be very good. So as you can see, the nanometers are going to be very different from your 755 to 164. So we need to make sure that this is going to penetrate safely into the darker skin type. So if you are your phototype 4 to 6, the laser needs to penetrate quicker into your, so it doesn't cause any burns. Compared to your Alex, it will go a little bit more faster because there's no melanin on your skin. So the darker you are, you have more melanin. And the lighter your skin type, you have less melanin, but then the laser will penetrate quicker. So as you can see, the 755 will be like this, but then when you do your 1064, which will be deeper down. So we have to really get into the laser very quickly in a safe manner to reduce any burns to the area of the skin, which we'll have a look in a moment. So now you have to understand the different type of commons of the laser. Then in our clinic, we have a diode technology, which is your 8 to 10 nanometers. So this one, as we said, the Alex would be smaller, your YAG a little bit more deeper. This one is just in between. So this could be your Alexandra, your YAG, and your diode in the middle. So remember, it's going to be your Alex, diode, and YAG. So then you have your 3 types of nanometers to make sure we're going to be doing it a safe way in this area. So this will be affected, so borderline range of skin types. So from your light, medium, dark, and of course your hair type, depending on how deep it penetrates into the laser. Most clinics nowadays, we do work between your diode laser, as we are in London, so we are very diverse. We do have different types of skin, as we was actually looking at yourselves as well. So you of course are from South America, from Chile, and yourself as well. And you can see you have different types of your different types of Fitzpatrick's and your hair types and colour as well. Now we have one technology which is very old, which is your ruby. So when first laser started, ruby was actually your first laser hair removal. Ruby only worked with your Fitzpatrick 1 and 2, which is, this is going to be the 1064 nanometer. It is a very older technology, and it's affected only by light skin and dark hair. So if a client is your Fitzpatrick 1, 2 and maybe 3, but have to have darker hairs. So in your case, ruby would not be a very good laser for yourself as well. But ruby is an older technology which now we don't use. There's not a ruby laser, I don't believe, in parts of the world. Then of course we have another type of technology, which is your impulse light, as most of them call it, is IPL. It's not truly a laser, but it's broader spectrum light. So we have different types of light when it comes to laser. So when you're looking at your common side of your laser, so yes, your ruby, your ND YAG, your Dio and your Alexandrite, so your 1064, your 810 and your 755. So what these do, you have one laser light which is straight down. So this is going straight into the area. So if I just kind of show you a little bit here, it will be straight into the follicle. So this light points down. Then you have your IPL, which in some cases we have IPL, but different type of light in the industry. So our light that we see is it's a form of an IPL, but it is not, because it flashes out. So with your IPL laser, it flashes out, but then your common lasers, which is for hair removal, it goes straight down. So these are going to be your Alex, your Dio, and your of course your ND YAG as well. So this will go straight down. Your IPL will go sideways. So of course a lot of clinics do offer IPL for different types of technology. So again, like I said, this is very good. It is still quite invasive type of technology. This works very well when you have pigmentation, so sun damage, little varicose veins around the nose. So IPL works very well for different types of, but not for hair removal usually. So we have to be very clear in what type of technology we'll be talking to our clients to make sure everything's all designed in that way. So how do we choose the best machines depending on your skin tone? So your Fitzpatrick's and your hair color and your characteristic. So this has to be professionally done by all of you. Once you start your industry, you need to make sure your lasers that you have in your clinics, and make sure you do a nice safe procedures to your future clients. We mentioned before, our Fitzpatrick is very important, so we know to identify the skin color, to know what laser you'll be using as well. So as we mentioned before, your Fitzpatrick 1 to 3 would work very well with your Alexandrite. Your Fitzpatricks from different types, so from your light to your very dark skin types, you can work with Dio, which is your 810, and your very light, darker skin type, which is from 4 till 6, you can work with your ND YAG laser. By doing this, you will place laser in a safe manner. Unfortunately, if you do not understand your Fitzpatrick, you can burn your clients, and we can look into your 3rd degree burns, unfortunately. Another step that we need to look into is lots of types of things that happens on the body. So we have beauty spots, we have tattoos. So we have to make sure we avoid touching them with the laser. So for example, if I can borrow you, Monse, you have a tattoo on your arm. So we have to do 2 fingers away, 2 fingers away, and 2 fingers away. So we have to make sure we play laser very safely. Unfortunately, these hairs will have to stay because we won't be able to do on that area, as we can actually burn your tattoo. Now we need to look into forms of your medical condition. So this is going to be now part of the consultation / patch test that we'll be doing in the clinic. But we need to make sure that we will do laser in a safe and effective manner. So here we have, of course, your medical contraindication. So we need to double check with our clients that they are not pregnant or breastfeeding. If your client is pregnant, no. If your clients are breastfeeding, no. They have to wait. Breastfeed, they have to wait after 3 months before they stop breastfeeding. Then they can have laser hair removal. We need to make sure our clients are not photosensitive. So this is very crucial that you have to understand this with your medical concern. So photosensitive, no. If your client has epilepsy, we have to make sure, because we work with laser. Light, as we were discussing before, you have impulse light, which is like this, and you have your laser light, which goes down. So we have to make sure we're very understand about epilepsy. Keloid scarring, again, it's a bit of a grey area. Sometimes we can treat, sometimes we can't, but you need to find out with your clinic manager to see if it's safe or not safe to do your treatment. Infection, so this is going to be your active herpes around, if we do around the nails, or of course intimate area, laser, not on the area. Also open wounds, make sure we can't have any cuts or bruising or anything like that into your laser, as unfortunately I've got a scratch here. So when you have redness, this automatic, your laser will think this is hair, not and a scratch. You are the eyes of the laser. The laser does a job, and you need to make sure you do the job correctly. If the client has a bruise, again, we have to avoid it. We have to work around it. Bruise has a melanin, which is activated on the skin. And again, the laser might think it's actually hair and not a bruise. And again, it might confuse the laser. And again, burns can happen. So we need to make sure all of this. Now, skin disease, so this is going to be your arthritis, eczema, and other skin condition. If it's on the elbows, we might have to avoid. Again, you have to use your common sense in this moment to see if the area is active or not active. If the skin is very dry, you avoid the area. You can't treat on that side. History of cancer. Again, this is after a request once they're in remission and they need a doctor's note. So if someone comes, they have cancer, is no. Once they're in remission with a doctor's note, again, this be part of your medical questionnaire that you will be presented in clinic to make sure you do everything in a safe manner. And diabetes as under control diabetes. So we have 2 different types of diabetes. You have your type 1 and 2. Of course, if all is under control, we can do the laser hair removal. Again, you would have to ask your clinic manager in that moment. Now, the other focus is going to be medications. We need to find out what medications they are taking. So we need to find out first your medical, which is going to be your medication. So photosensitive drugs, need to make sure they are not taking any photosensitive drugs. Blood thinners, hormone medications, and gold therapy. Now this you need to discuss one-to-one with your clients to make sure. Of course, any of these type of treatment, we won't be able to do the laser. Again, it has to be under medical care. And again, you need to ask your clinic manager in that moment. And here, as we discussed, of course, you're going to be your hair and your skin and factors. So tan skin, so this is something that we have to really talk about. So if your client is gone to the Caribbean and they come back yesterday and today they had the laser treatment, they cannot do the treatment. They need to wait 2 weeks before and 2 weeks after before we can place laser in a safe manner. Tattoos, as we've already discussed with Monse, it has to be 2 fingers away from your tattoo. And of course your lightning hair. So as we were talking about the characteristic of the hair, so white, grey, red and very blonde hair does not respond well to your laser. So lastly, of course, we need to explain to our clients that they can't wax or pluck. A minimum of 4 weeks for the follicles inside to grow, which is going to be your hair shaft, the papilla that we were talking at the beginning of everything. So we have to ask the client to only shave, that's it. No more plucking or no more pulling the hair out. Now, if they do this in between the laser treatments, unfortunately the laser will not work. So it's down to you to do a correct consultation in your patch test when we see your clients. Now, when it comes to Botox and fillers, they need to wait 2 weeks in the treated area. So if they have Botox or fillers or anything around here, they can do the treatment of laser hair removal, but they have to wait 2 weeks. Now, some of our clients are going to be using active retinol, which it could even be topical or oral. They need to wait 7 days. So that is very crucial because the skin becomes a bit more photosensitive, and again, burns can happen within the laser treatments as well. So we need to make sure all these factors, so from your medical condition to your medication to your hair and skin factors, and just make sure everything's all correctly done when you do your consultations. Okay. So the next level that we need to talk about is going to be your PPE. So we need to make sure we are doing everything safely in clinics. So we need to make sure that we have, the most important are going to be your glasses and goggles. They need to be registered to your nanometers that we was talking about at the beginning, which is going to be your Alex, Dio and your NDY YAG. So your glasses has to have right inside the nanometers of the laser, so then your eyes are going to be protected for this as well. So you have your goggles, and you can even have glasses as well, so you can be given 2 options, but of course the therapist needs to wear your glasses. Your clients can wear glasses or goggles depending on what the clinics will be using. One thing as well is be your protected clothes. So for hygiene reasons, every clinic should provide you with uniform, so they can provide your correct PPE equipment in clothing. So we need to make sure everything's nice and sanitized. Make sure your uniform, you wear it in clinic only if you are going outside to change into your normal clothes that you have. So then that way we can maintain with anything with germs. So one thing we should technically wear is long sleeves, and we should be wearing all the time when we touch in our clients are your gloves. And gloves, they should be disposed after you do the treatment. So make sure everything's going to be nice and sanitary beforehand. The next level, of course, we need to have, it's an optional, you can wear face masks as well. So that's something that you can definitely use into. So it's very important to have a good ventilation in the clinic rooms, especially when we do laser hair removal. We do have to have a warning sign of control of light as well, which it has to be on the front bar of the door before you enter. It's very important to knock first, wait for your response before you enter into the laser room. So we are going to talk about the different type of cooling of different types of machines that we have. So we have, of course, a soprano laser and YAG laser that works with cold gel that you apply onto the skin. So this, by applying the skin, it's actually cooling the skin down, and most of the time the head has a cold tip. So you cool the skin down and then you shoot with the laser. It looks like more like ironing in the way, so you're doing this. The good thing about this method of laser it doesn't show a lot of the airborne particles from dead skin types or even small hairs that jumps or even your dead skin cells. So that's a way of protecting from this. So you don't have to use a face mask if you don't want to. Then you have other types of the cool air, which is cold air that throws onto the skin. So you have two types. So you have your laser and your cold air. So usually it attaches together. And it has like a small little circle where the laser throws out and you hover over the skin. So this doesn't use any cold gel or anything, any ultrasine gel. So by shooting, unfortunately, it does throw out a little bit of air particles of the air, so your the skin, a little bit of hair. So this is why it's very important to have a good ventilation in your clinic. So, and it's good to wear your face mask as well, so this you don't get it into your own system as well. So with your two cooling system, you have to make sure you're wearing the right PPE. Hello there, Marla. So now we're going to go through the consultation. Before any laser hair removal, we do need to go through a consultation so we can make sure that we'll do the treatment safely for our clients. So if we have a look here, this is going to be now the medical history and medical questionnaire for the clients. As we already went over, what is a contraindication? You need to double check all your contraindication in following. So no epilepsy, diabetes, so we can make sure that the laser is going to be performed safely for our clients, okay? We do have someone that's going to come in today, so we need to find out what is going to be their Fitzpatrick's, their hair dents as well, and just to make sure if all of this is fine, we can continue with the laser, okay?
Perfect.
So first of all, we always
in my
have to
case,
double check.
I don't have any of
Perfect.
the medical conditions.
So we put no, lovely, and then we need to check if the client's going to be taking any medications as well, just to make sure none of it is going to be sensitive, photosensitive medication as well, okay? And double check that they have no allergic reaction either for anything. We don't use latex gloves, but we always have to find out if our clients do have any allergic reaction from this, okay? We need to check if they're taking any medication as well, so any retinol, John won't know, so we already went through all of this beforehand, so it's always very important. If they suffer from any allergies or nuts, so then again the client, make sure this is always filled in by your clients. You can help them if they need any assistance or anything, okay? So any medical allergic to medication, so just put no here for me, perfect. And then, so very important as well to ask about exercise. So we do need to say to the clients after the laser, they can't do any form of exercise. So we need to make sure, and this is quite good to know, so then we know to inform the client after the treatment that they can't do any form of exercise, okay? Most important is going to be the medical history so we can perform the laser hair removal as well. Once we do all the medical consent, they do need to sign the form before anything, and then we'll save the area. The other thing, we need to make sure that the clients are informed about everything, what we need to do regarding the laser as well. So how many sessions they will need. So we do recommend a minimum of 6 to 8 sessions on the body every 6 weeks. On the face, a little bit more. So we do recommend a minimum of 8 to 10 sessions every 4 weeks. So it's very important when we do the consultation that we inform our client about everything, the do's and the don'ts as well on the area. And then after, we do ask the client to shave the night before, nice warm soapy water before their treatment. So it's very important as well to do that. So once we bring our client in, we'll go over the consultation and the medical history as well. And of course not to have any active ingredients on their body. So maybe oils or creams, deodorant. So all of this we have to really make sure our clients don't wear any on the day of your treatments as well. Now if your client come in with oil or any retinol or any advanced treatment topical, are we allowed to perform treatment on her?
No.
No, perfect. So always important to find out as well, okay?
Perfect, great.
So we're going to go now through the consent of the laser, so we'll make sure, as we mentioned before, very important to let our clients know how many sessions they will need. and how the laser will work as well. So we're going through the root of the melanin of the hair, going to the follicle to destroy that area. One session is going to be done every 6 weeks, so it's very important to inform our clients everything as well. Okay, so here we're going to have a look at how many sessions some females and males client. Of course, everybody varies from sessions to session, especially if clients do suffer from hormonal imbalance as well. So it's very important to find that out as well. And then the session is going to be done every 6 weeks on the body and every 4 weeks on the body. Okay,
The
so
face.
on the face area. We always have to ask our clients before any laser hair removal of any changes to any of the medical history or any consent that they have, so we can perform treatment nicely. We do need to ask the clients as well about any sun exposure. So sun exposure is something that we have to find that out as well. If they had any sun exposure, active sun exposure, less than a week, we might not be able to perform treatment. So each time that the clients ask, we need to find out about 1, their medical history, and then 2, about any sun exposure, and of course 3, if they're using any topical ingredients onto the area of the body. Very important. So we can just avoid any side effects for the laser as well. Okay. So here we have, of course, the side effects that can be common, unfortunately, but this is why it's the therapist's job to make sure you inform your clients the do's and the don'ts of the laser as well. So any side effects as well. Okay. Rare, of course, situation can happen, like such as burn, as we mentioned in our previous lesson, on how to look after that area. So just inform, never panic. Always just try and cool the area. Of course, if you see any redness, any blisters in the moment when we are doing the laser, maintain calm and maybe just cool the area and just double assure your client she's in safe hands whilst she's with yourself as well. So one rule is never panic. That is for sure not to do that. Just cool the area down with a cold compress and then just keep an eye on it for a few minutes just to see if it's going down. So we're going to put the cold compress onto the skin, cool it for a little bit and remove, and then just keep an analyze on that for a few seconds. Cold compress and then let's carry on with the treatment. But that is worst case scenario, but it's always good to inform yourself what you need to do in that moment when we are doing any type of laser treatments. Of course, we do have to wear our PPE, so our glasses to protect the eyes. So always check, lift your glasses up to see if there's no reaction on the area of the skin. Okay, so we just double check everything as well. So of course, knowledgeable by the to just make sure everything's all signed for anything. So we need to double check everything's signed, all correctly informed with your clients as well. Okay, any questions from your consent or any things that you would like to ask?
No, it's clear.
Perfect. So just grab your signature there. Lovely. Perfect, and then we'll sign and close and submit. So next option now, as we mentioned, we work with a diode technology. Okay, so we do have a few areas of the laser. So we've got 1 nanometer which works your 1064. Then of course you've got another nanometer which is your 735. And then of course this one's a diode which is going to be your 810 nanometers. We went through the laser difference, and this is what we work in our clinic as well at the moment. So this is a diode. How you need to turn everything on is make sure everything's plugged in beforehand. Okay. Then we use the key to turn everything on. And then these are going to be your protective equipment as well. We always have to make sure we wash our hands beforehand as well. We wear correct uniform, so we don't wear any outside clothing in the clinic, so everything performs more neutral and clean. We wear gloves before anything. We make sure our door is locked at all time when we're in the client, when we're performing the lasers as well. Okay. So we come to this screen. So we usually go into introduction and then of course epilation. And then we do need to put the foot pedal just through. It's wireless, so we just need to make sure it's all connected. And here you're going to choose your lasers that we'll be using. One works for larger areas of the body, so the difference is this is going to be much more bigger, so this is going to be more for the body. And then 1 is going to be performed on the area of the face. So you can see it's nice and small on that part, okay? Make sure whenever we put our laser back, it's always performed safely and out of the client's way so no one gets hurt. Here we have to choose area, so which one are we going to be using? So we're going to use body or face, which we're going to do the body now, that's what our client wants to do. The type of the Fitzpatrick's, as we know, this is going to be your lighter skin type, and then of course we work to our darker skin type. Then we have the depth, how much hair is in that area, okay? And here we need to check the thickness, if it's thick, if it's fine, to know the correct settings as well for the laser. So let's just, all in all, will protect. So we do need you to wear your glasses before we go and do this. Always protection first. So we put yes, and then it gives you certain settings. But of course you always have to have a look at the skin, at the depth of the hair, and then double check if it's all going to be correct in the settings that we'll be doing. So we'll show how the laser works as well, okay? So we'll bring our client in just to find out, and then I can show you how the actual laser will work as well, okay? This is our client, Jacqueline. So we're going to be
Good
performing.
morning.
Good morning.
We're going to be performing the laser hair removal on her leg. So I'm going to talk to Jacqueline first, just to double check all the consent and medical history is all filled in. So yeah, thank you so much. So Jacqueline, we already went through your history of your medical history already. I can see that you're not taking any medications, you haven't had any sun exposure, and so all in correct way. You're not allergic to anything, are you?
No.
Perfect. So just have a double check all the time. And the consent is already filled. We did your consultation beforehand, so you know now that on the laser for your legs, we do recommend a minimum of 6 to 8 sessions every 6 weeks as well. The only thing you can do, remember, is just to shave the area. Don't do any waxing, no plucking, nothing to remove the hair out of the root, which is very important, okay? Make sure no more waxing, okay? So we can carry on. Now, do you do any exercise in the evenings? Usually? No, perfect, that's great. In the laser sessions, after we perform your treatment, we do advise the clients not to have any heat treatment. So no hot showers, no saunas, no massage, nothing to cause friction to the area, just to avoid anything on the part, okay? So we're going to be performing laser hair removal. So I'm going to apply an ultrasound gel, and the laser is going to feel quite cold. So we're going to go through a little bit slowly, okay?
Jacqueline, good morning. I am Marla. I will be your therapist for today. We will perform laser hair removal. I just need to check the medical questionnaire and the consent form. Here I can see you are okay. You are not taking any of this medication. But I just say something about the vitamin C. Vitamin C is okay. You can continue taking vitamin C. Perfect. Good. And in the patient concern, you already feel, and we can perform the treatment. Just remember I can see you shave the area. Just shaving before of the laser hair remove. No waxing, no twist, and nothing in the area, okay? Don't apply the day of the treatment any lotion. Just have a shower and that's it, okay? The session will be done every 6 weeks. And you will need between 8 to 12 sessions, okay? Perfect. Any questions? You have any questions, Jacqueline?
Nothing.
Perfect.
Perfect. Now I'm going to be showing you how to do the treatment.
Perfect.
So this is the iPad. Make sure always we wear gloves before anything, and of course our PPE is very important. So what I want to have a look first, we can always put the bed up a little bit. So Jacqueline has shaved already, so I want to know which Fitzpatrick, by looking at her hair right now, which Fitzpatrick is she now?
4.
4, okay.
She is phototype 4.
Okay, lovely.
Perfect.
Jacqueline, when you go in the sun, do you usually go very brown or do you usually burn?
Brown.
Brown, straight away brown.
Yeah.
So just by asking just certain questions regarding how the skin reacts in the sun, it's always good to know what she will go. So definitely more in your fault. Now, can I have a look now? You can see the blackheads as well, where the hairs are nice and juicy. Would you say they're quite coarse or quite fine hairs?
In my opinion, it's medium.
Yeah.
It's not too a lot of the hairs.
Mhm.
It's medium, the hairs,
Yeah.
and about the tightness
Yeah.
is
Perfect.
medium too.
Yeah.
It's not so, it's not fine, but it's not too tight. I
Perfect.
think so. It's
Okay.
medium.
Yeah.
You're okay with
Yeah,
that?
that's perfect.
Mm.
So now we're going to set up the laser. So if you can just set up
I
for
am
me.
checking here. It's
Yeah.
on. I will
Thank you.
switch on the machine.
Yep, with the keys. Perfect.
Mhm.
And then make sure we always turn on
The pedal.
So I'm going to show you how to put the gel on first
Mhm.
with our PPE equipment, our glasses, perform the treatment, and then you will take over just to see you're comfortable and
Okay.
doing the
Perfect.
laser as well.
Good.
Okay.
Mhm.
So we said we were going to do
We are starting the indication.
Yeah,
Like I
perfect.
mentioned before. Epilation, we will do it hair
Yeah.
remover. We need to press the pedal. Good. We will work in the body, in its exhale and its body area. Now, like we checked before,
the
is
Fitzpatrick's.
phototype 4.
Yeah.
And now in the density, we say it's medium because of the amount of the hair. Medium, perfect. And the thickness, we say there are different types, but it's medium definitely. No?
Perfect. Yeah.
Okay, now we set the machine for that.
So now it's not on, so we're ready to do the
Mhm.
treatment. Make sure always you put your glasses on with your clients as well.
Okay,
So,
glasses for you, Jacqueline. Mm-hmm.
so before we start, I'm just going to show you how the laser treatment is performed.
Mm-hmm.
So we always here we work with an ultrasound gel. So nice cold gel. So you warn your client it's going to be a little bit cold. I have to warn you. Just a very fine layer.
Mm-hmm.
Yep, it's going to be very, very cold. So we apply it everywhere on the legs, but we're only just going to do a little small patch today, so not too much. Then once that's on, we bring the laser close to us. So we have to ask the clients, this is going to be very cold as well.
Mhm.
So this is a chill tip. So we discussed already a few lasers has a cold air and a few laser has a cold tip, which the diode technology usually does have the chill tip as well. So you bring the laser a little bit closer for you. You bring this close and we cool the area first. So always in contact with the skin. The laser itself is quite heavy. Always make sure you grab it properly. If this falls on the floor, not good, okay? So make sure always in contact with the skin. Not like this, we're always going to have in a 90-degree angle on the skin. By cooling the skin down, 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 and then we press our foot pedal, the laser will come out. And this is very important for us to wear our glasses and everything. But make sure always cooling the skin down at a 90-degree angle. Some clients or some therapists can go a bit more faster, but at the beginning it's always important to do it much more slowly so we can just make sure we get the laser in contact, okay? So very good in your settings, so very precise of how the density, the Fitzpatrick's, you already make sure the client is in safe hands as well. If you see any redness or any after the treatment, make sure we're always going to check the skin once we perform one line. So the client will need to feel a prickly feeling and no heat sensation. In the moment we perform laser, it's going to feel like a sharp little elastic band area, but mostly all cold as well. If the client is feeling a bit hot, we might have to go a little bit down, okay? So if we have a look here, the setting is showing 7 joules, which is still good to perform. Jacqueline's already done her patch test, so we did on the 7 joules already. And the hertz is how speed the laser can go. So one speed is more beep, beep, and a little bit of 1.5, your speed is a bit more faster. At the beginning, I want you to do with 1, just to make sure you're comfortable with the laser, and we make sure we are on a 90-degree angle. Very important, okay? So before we start any type of treatment, we always have to make sure our PPE is on. So we'll make sure, and now we have all the settings. So we said we were going to do phototype 4, more of a medium type of hair, and the hair thickness is in your middle. So we'll press yes, and then usually to press, we'll go in here, and this is the part we do need our protective glasses. The lovely thing about the laser, it actually shows you that you will need, but we won't perform here. I just want to show you how the laser is. So now I want you to get the laser and just do pretend on the skin, just to make sure we are on a correct 90-degree angle, and just explain to your client the gel is cold, unfortunately, and the chill tip. Cool the area down, and remember, no, it has to be always in contact. Do not lift the laser up all the time, okay? So if you just come over and then just show.
Okay, Jacqueline, I will start to perform the laser. I will apply gel, so cold. Okay, but it's necessary the cooling in the skin. I will apply the gel. Perfect. Jacqueline, you can feel the pricks. The pricks is when the laser goes inside of the follicle. Okay? Good. I will cool in the area first. Cooling, cooling, cooling. This is just when we cool in the area.
Lovely.
Perfect. And now I am sure it's in the full contact with the skin.
Perfect, you are.
And press the pedal.
And then the laser, slowly, slowly. Yes.
Slowly. Maybe if the client feel a lot, can I call in more?
Yes, you
Perfect.
do. Yeah.
Good, good, good.
So only Jacqueline needs to feel is that pinprick feeling. Now,
When
anywhere that
coming
is a
in the
bit
bone,
bony, you have to be very
maybe like I
careful.
just say, we could do it here.
Yeah, very
here.
slowly.
Slowly, 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 slowly. Perfect.
And your gel is going to be your guide as well. So you can see where you have done on this area. And now we just kind of need to follow through. Overlapping is very important for this type of treatments as well.
I create this line,
Yeah.
and never I go in the top of the next line.
Perfect.
Good. And now I am going here.
And you can see that the laser head is quite heavy, so you don't need to put so much pressure. Just a little bit, so you can make sure
in the pressure
it's
is okay. Perfect.
always make sure it's just going to be going on your 90-degree angle. In some cases, you can go a little bit more faster. However, somewhere where it's a bit bony, so your ankles, your knees, always do shot by shot. Make sure it's always on contact. It's the most important.
Okay.
As well.
For example, in the
Yeah.
middle when it's bone.
Yeah, we can do shots. Okay. So very important is always to remove the gel from your client. Okay. So we have a little tissue there to remove everything with the spatula. We remove the tissue, and we need to say to the client about our aftercare. So let's turn off the laser. So if you don't mind, turn the laser off by doing it anti-clockwise. Perfect. And then now we can see the skin. It's not red. It's just a little bit of swollen follicles, which is totally normal, especially because the thickness of the melanin is active as well. So just ensure your client is very safe to do that. You can feel the skin is nice and cold. So we need to apply now aloe vera gel. So we have some there. Yeah, perfect. Let's just put some on the client for Jacqueline. Lovely. So Jacqueline, the treatment has been performed, and we, as mentioned before, we need to double check your aftercare is very important. So avoid any heat treatment, no hot showers, no saunas, no gym, nothing whatsoever on this case. And very important, the next session will be done in 6 weeks' time. Okay, the only thing you can do is only shave the area. Okay, so Marla, I'd just like you just to repeat one more time to Jacqueline.
Jacqueline, the aftercare is very important. You need to avoid the sun for a minimum 1 week. Don't
I love it.
Jacqueline, now the aftercare. Please don't expose the skin to the sun, no gym, no exercise, no sauna, steam, swimming pool, okay? Avoid any physical activity to swollen and inflame the pores, okay?
As well, in your next time of your treatment, which will be in 6 weeks' time, if any changes to your medical history, please give us a call as well. We always will inform our clients before the treatment if anything has changed, but it's always best to double check as well, okay? Thank you so much, Jacqueline, for coming
Thank
over.
you.
Thank you, Jacqueline.
And Marla, any feedback for anything that we mentioned, anything you're a little bit lost?
No, everything is clear. I can see how the points, the redness are
Yeah.
totally normal. Yes, I am happy with everything I learned today.
Thank you
Thank
so
you
much.
very much.
Thank you.